Well, my blood pressure's high. I just had my blood pressure checked. I don't check it at home. I go somewhere where they check it for me. And it came back.
Quick disclaimer, this is not medical advice.
90.
This is just
I've
me
been keeping an eye on
my
this
own personal experience
because I'm on testosterone
when it comes to
replacement
testosterone
therapy.
as with anything else.
That always
consult with your
screws
doctor
with my
and
blood
follow his
pressure, big
advice.
time. So I want to say over the last 2 months, it's been elevated. I've been getting readings from 140 to 155 over 90, 95. But this is nothing new with me. So I've been on testosterone replacement therapy now for approximately 10, I think it's close to 12 years. And the issue is whenever I get my levels up to where I'm starting to feel optimally, subsequently, my blood pressure goes up. So my normal blood pressure is 120 over 80, 120 over 70. That's normal for me. But once my hematocrit starts going up as a result of the TRT and my red cells start going up, my blood pressure goes up. So if I were to go out and donate blood today, like right now, if I donated a pint of blood, my blood pressure would drop to 110, 115 over 70. And it would stay that way for a good month, 6 weeks, 4 to 6 weeks. And then it would slowly start creeping up. So I know it's the testosterone that's doing it. I've had this problem for 10 years, but what I did was about 4 years ago, I cut back on my dose. So I reduced the dose of testosterone, cypionate, to a much lower degree. I'm just trying to pay attention to the road as I'm talking, so excuse me. I reduced the dose to a much lower dose, enough where I didn't feel like total crap. I could function, but I wasn't, optimized. I wasn't optimal. I reduced it down. I cut the dose almost in half. And I went from 70 milligrams a week of testosterone to 35, approximately. And that kept my blood pressure in check. It was okay. It didn't elevate. Also kept my hematocrit in check. But every time I increase the dose of testosterone, my blood pressure goes up. So, and I cannot donate blood, by the way, anymore, because now I'm anemic from all the blood donations I've done over the years. So I cannot afford to lose any more blood. So this is really a pickle, and I'm not the only one. I know a lot of guys on testosterone have the same issue. I have an appointment first week of March with my TRT doctor. It's a clinic where they only do testosterone, and I'm going to ask him if I could try this new nasal spray or nasal gel. It's testosterone administered through the nasal membranes. I think you spray it in your nose, or you rub it in your nose once a day. I believe. I'm not really that familiar with it, but everyone is telling me in all of the TRT forums that has been proven not to raise hematocrit substantially in most people. Not in everybody, but in most people. So I'm going to ask the doctor about that. Until then, I'd lowered the dose again. I cut it back a little bit just to keep the blood pressure in line, because I don't want to have a stroke. It's not worth it. It's not worth feeling good from. It's not worth having high testosterone or normal testosterone if it's going to give you a stroke. So that's where I'm at right now with this. This is just a short video, a little rant of mine about my blood pressure that I just cannot control when I'm on an optimal dose of TRT, of testosterone. And by optimal, I mean 10 milligrams a day or 70 milligrams a week. That gives me an optimal number, but it also messes with my blood pressure because it elevates my hematocrit. So I'm going to see if I could try a different method of testosterone administration. So instead of injecting, I'm going to ask the doctor if I can use the nasal spray or gel. I'm not sure if it's a spray or if it's a gel you just kind of rub into your nose. But I'm going to ask my doctor about that because, I'm 60 years old. I can't be walking around with high blood pressure. God forbid something happens. And I will report back to you on how that goes. So that's my rant of the day of high testosterone and high blood pressure. They seem to go hand in hand. Later.